Fellows in our program rotate through a number of institutions, including Tulane University, the VA, and Ochsner Medical Center. Each day of the week, our fellows do something different. On Monday, you may go to the VA. On Tuesday, you may be at Ochsner. Wednesday at Tulane. Thursday might be a research day, and Friday something else.
We do get a lot of continuity with our patients, particularly at two of our sites, Ochsner and the VA, because no matter what block we are on, we are always spending at least one day at both Ochsner and the VA, so we can keep following our own patients.
Our fellows are exposed to patients with significant, unusual disorders of allergy and immunology. Beyond this, we pride ourselves in exposing our fellows to procedures, high-risk procedures that most fellows across the country aren't comfortable with at the time of their graduation. This includes a variety of food challenges, ultra-rush desensitization for venom allergy, and drug desensitizations in the clinical environment.
All the exposure we get to different sort of procedures, we get to do rush immunotherapy all the time. We get exposure to oral immunotherapy, particularly with peanuts now. We get to do challenges such as food challenges and medication challenges. So we get to do a lot of different things like that. We also get a lot of allergy shots, and we write our own immunotherapy prescriptions.
Clinical cases that our fellows frequently encounter here that are harder to encounter elsewhere include venom allergy. In fact, that's my specialty. In addition, there is hard to control asthma in children and adults, specifically because of the high exposure to indoor allergens that we have in this area.
The reason I'm here at Tulane is because I love more than anything in the world getting the fellows excited about learning.
We allow our fellows to explore areas of research that are personally interesting to them. We think it's really important to gain the skill sets that you might like to take forward with you in your career. Some of our research opportunities include benchtop research. Most of our fellows engage in clinical research.
Another clinic that I get to go to that I love in the community is schools, and so I see students in schools who have asthma. And these students I'm able to follow throughout the school year and often from year to year and make sure that their asthma is well controlled. And the great thing about that clinic is that they don't have to miss any school and their parents don't have to miss any work, because I can see them, for 15 minutes in the middle of the day while they're at school. And so that's a really nice benefit, great continuity there. And we get to do a lot of spirometry and asthma education and make sure that everybody is all nicely well controlled at their schools. And then the final thing that I like to do is EpiPen training for the schools. And so I'll go into the schools and show teachers and coaches and bus drivers and administrators, whoever wants to attend, when to use an EpiPen and how to use an EpiPen, and so they can best care for people who might have an allergic reaction in the setting of a school.
The number one attribute that we're looking for is a sense of inquiry. We want our fellows to be deeply interested in the well-being of their patients, to explore what might be going on pathophysiologically or what might be going on socially that brings them to the clinic.
We have great attendings. They're so friendly, and we can always go to them for advice. Whether they're on call or not, I feel comfortable calling any of our attendings to ask them what they think about different things. Also, our co-fellows are just amazing, and we have a great time together, and it's just a great environment.
I really enjoy getting to work one-on-one with our fellows, teaching them different practice styles, different approaches to solving problems when there is no clear answer to the problem that they present with.
I consider us one big family, and we work together and play together, and if ever the fellows have a question or want to run a case by us, even if they're working at a different location, they're always welcome to call us, text us, whatever.
Most of our graduates will go on to be practicing community allergists. They provide very high levels of care in the clinic setting. Our fellows are inquisitive. They're interested in their patients. They're interested in advancing the fields in which they're working. Tulane University's Allergy Immunology Fellowship Program is a great learning environment.